Okay, so the first thing I'm doing is checking the patient's charts to make sure we have the order for the Foley to see if there's any limb restrictions, and just make sure that we're doing it on the correct patient. So, hi Mrs. Jones, can I come in?
Mm-hmm.
Hi Mrs. Jones, my name is Sophia. I'm going to be your nursing student today. Could you tell me your name and date of birth, please? Okay, very good. So I'm here to insert that Foley that we talked about earlier, okay? Do you have any questions on how that's going to go? No? Okay, I'm just gonna raise up your bed a little bit. And I'm gonna start getting some of my supplies ready. And do you have any allergies to latex or iodine? Okay, just an iodine allergy. All right, so I'm gonna get everything set up over here. All right, Mrs. Jones. So this procedure might be a little bit uncomfortable, but it'll be pretty quick, okay? I'm just gonna pull back your covers. I'll try to keep you covered up as much as possible, but we'll have to expose the area. I'm gonna help assist you into a dorsal recumbent position. So I want you to spread your knees up like a butterfly. Perfect. Okay. Pull your gown up a little bit. And I'm just gonna place a pad underneath you. I'm gonna clean you up a little bit before we do our procedure. So this will just help any water that might fall. All right, Mrs. Jones. So the first thing I'm going to do is just clean you up before we insert the catheter. So I've got some warm soapy water. I'm going to clean one side of you. Go ahead and clean your other side. And straight down the middle. And now I'm just gonna go in with just water to rinse you off. Middle. And one more down your other side. Very good. And I'm just going to dry you off a little bit as well. Okay. Go ahead and take off my gloves. And at this point, if the pad or the chalk were to get soiled, I would dispose of that as well. But since it didn't get anything on it, I'm going to leave it. I'm going to clear my area. Perform hand hygiene. All right, Mrs. Jones, so we're gonna go ahead and get started on the procedure. Take out package. Drop that into the garbage can. And I'm going to go ahead and place this. Open the first one away from me. Okay, so now that I have sterile gloves on, I can touch everything within my kit. So I'm gonna go ahead and pull out my first straight. Make sure that it's shiny side down. I'm going to airplane that between her legs. And I'm gonna use the second one to just continue my sterile field. And this one we won't be using since she's a female, so I'm just going to go ahead and get rid of that as well. And since she said that she has an iodine allergy, we won't be using that. And I'm going to go ahead and prep everything that I need to while I'm still sterile. Turn this to the side. So if we were to get a sample, we would use this as well as the specimen cup, but since we're not doing that, I'm just going to place that to the side. I'm going to place my lubricant onto the tray. I'm going to go ahead and fluff up my cotton balls and place my hydrogen peroxide cleanser onto the cotton balls. And lastly, I'm just going to remove the sheath from my catheter, being careful that it doesn't go out of the sterile field. So I'm going to get rid of my sheath and place this back in here. Great. So I'm going to grab my cotton balls that have the cleanser on them. All right, Mrs. Jones, you're going to feel my hand on you, okay? I'm going to spread her labia and form down each side. And one down the middle. And I'm going to drop my tweezers as well. I would move these into the sharps later on. And now that I'm done with cleaning her peri area, I'm going to go ahead and grab my catheter and place it in my lubricant, which I lubricated about 2 to 4 inches of the catheter. And I'm now going to begin with my insertion. So the first I will insert 2 to 4 inches. Mrs. Jones, I want you to take a deep breath. You're gonna feel a little bit of pressure, okay? Right, so now that it's 2 to 4 inches, I see that there is urine flow into the tube, so I'm going to go ahead and insert another 2 to 4 inches. Okay, and I'm going to grab that with my non-sterile hand. I'm going to go ahead and inflate the balloon with 10 milliliters of sterile water. Okay, so now I'm going to make sure that there's resistance when I pull. I do feel that there is, so the balloon is working successfully to keep it in her urethra. I'm going to go ahead and pop my syringe off, place that down there, and I'm going to grab my bag and secure it below waist level. On the loops on the bed. And now that it's secured down there, I'm going to use the leg strap to secure it to her leg. And I'm making sure to do this below the Y junction so that it cannot be pulled out. So now that I see that that is secure, I'm going to go ahead and cover you back up, Mrs. Jones. If there was anything on my gloves at any point, I would change those out as well. These are clean, so I'm going to keep using them. I'm going to get rid of everything from my sterile field. I would also remove the chucks if it was soiled. Just place this over here, and I would clean up my entire working area, assist her into a comfortable position, lower the bed, put the call light in place, ask her if she needs anything else, and I would also perform peri-care if it was needed at that point. So I'm going to go ahead and place that away, and I would make sure she's comfortable, bed in lowest position, call light in place, check back up on her later on, but for now we have the removal. So I would come back in and do all of my introductory procedures, identify the patient, provide privacy, ask her about allergies, and all of that. So I'm going to go ahead and start with the removal. Using clean gloves for this. Since the bed is already at a comfortable working height, I don't need to do anything with that. She's already in the correct position that I need. So the first thing I'm going to do is grab a chalk as well as a urinal or any graduated cylinder to go ahead and collect the urine sample. So I would use this to drain I would use this to drain the urine sample into my specimen collection, and then I would look at the urine. I would make sure that the color, odor, clarity, and amount is appropriate and document that as needed. And I would dispose of this in the bathroom or wherever it was needed. I'm going to place that to the side for now. And now that the bag is empty, I'm going to go ahead and lift it up to the waist level. Easier for me in a little bit, and I do have a protective chuck down. Alright, Mrs. Jones, I'm just going to expose you a little bit. I'm going to remove my leg strap. Stay over here, and I have my syringe. I'm going to allow pressure to fill up the same amount of saline that I pushed into her earlier, so that should be about 10 milliliters. I'm going to let the pressure go ahead and work for that. You doing okay, Mrs. Jones? All right. So I see that I am about at the 10 milliliters that I pushed in. The syringe was about 1 milliliter short, so that's okay. So now I'm going to go ahead and grab right here. All right, Mrs. Jones, I'm going to go ahead and remove the catheter now. You might feel a little bit of pressure, okay? Take a deep breath. All right, so I removed the catheter. So I'm now just going to grab the entire thing. I already have a chuck on the ground earlier. So I'm going to take all of this and dispose of it according to facility policy. So place that there for now. I would remove the chuck, perform peri-care if she needed it. Go ahead and get her nice and comfortable. All right, Mrs. Jones, are you feeling okay after that? Very good. All right, so the bed is in the lowest position, the call light's in place, and the patient doesn't need anything else. So now I would just clean up everything that I use and make sure to perform hand hygiene on the way up.